We are made of cells, and each cell, well, most cells, contains something called DNA. Think of it as binary code for computers, a recipe used to make you. It's associated with coding for something called proteins. Now, proteins, think of them as ingredients, but let's not forget to appreciate the proteins behind the scenes. They act as event planners, if you will, planning a sort of event called the cell cycle. They have to clone themselves, and this means cloning the genetic material. And think of this as a game of Chinese whispers. The first person has to say a word, and it has to pass through a string of people. There should be no mistakes in between, and if there's a loss in translation along the way, that can spell chaos. In a very rough way, describe the basis of cancer, I say in quotation marks. Let's focus on colorectal cancers. Now, if what I mentioned earlier happened, DNA and the genetic material has been altered, we say that this is mutated. By any coincidence, this happens to affect the event planner proteins. That is a problem. There will be uncontrolled division of cells. There are many culprits, and these include
we can categorize them into modifiable factors and non-modifiable risk factors. What we end up getting is something we call a polyp. We don't actually call it cancer at this stage. It's known as a benign growth. For the most part, it's harmless. The only thing it does is grow bigger and bigger, a consequence of what we talked earlier, uncontrollable cellular division. So with more continuous abnormal cell growth, these long-standing polyps can develop into something more sinister, and that is what we call malignancy. It's more problematic, there's more symptoms, and it's just very difficult to treat at this stage. And this stage is what we call cancer. We say it's cancer.
Oh, it seems like there are 3 patients coming in for something. I'd like to introduce you to patient A, who has come in for a screening test. Patient B has come in because she's felt a few minor symptoms, certain mild changes in her bowel habits, some constipation or diarrhea, abdominal pain. She thinks she might have seen some red streaks in her stool, but she's not really sure. Patient C. Now, she comes in with severe abdominal pain, as you can see. She's complaining that she feels really constipated, and her stools lately have almost ribbon-like or pencil-like. She feels a fullness. She also definitely observed lots of blood in her stool. Sometimes she complains that it's very dark, had a significant loss of weight and a loss of appetite.
So what happens next? Well, all 3 patients were told to get smaller examinations and investigations done, and all 3 were told to get a colonoscopy. So that's where they basically put a camera up through the colon to see abnormalities and to pluck out any abnormal polyps or tissue that they can see. Then they sent it to histopathologists, who are able to take the tissue, put it through their microscope, and ultimately see on a microscopic level and are able to identify itself as benign or if it's more malignant. And that is crucial in determining the treatment for the patient. All in all, this is just a brief attempt at explaining the ins and outs of colorectal cancer. It's on the rise in Sri Lanka and actually all over the world. And while typically it affects people over the age of 50, there is an increasing rise in incidence among the younger population also. Pretty scary. So the idea is early detection is key. Unlike breast cancer, there's no set screening program set in Sri Lanka as of yet for colorectal cancer. So it's up to you to reach out to the doctors, especially if you're over the age of 50 and if you experience symptoms that we have mentioned in the video. Feel free to check out these websites. They can give you a better idea about colorectal cancer and maybe help answer a few questions that you might have. Anyways, thank you and stay safe.